Hello everybody, this is Dr. Ajay Krishna. I'm a prosthodontist and implantologist. And the topic today we're going to discuss is how important it is to have a crown after the root canal procedure is performed. And what are the different types of crowns or the caps which is commonly known in the market. What are the different types of crowns available and what's the difference in the material and the indications of the crown. What is a good crown for the front teeth and what is a good crown for the back teeth. Now, coming to the root canal procedure is done when somebody has got a deep decay, which is involving the roots, and we clean up right from the roots till the top part. So there is a lot of tooth structure which is already lost because of the decay, and any root canal treated tooth becomes brittle because basically there is no blood supply to that particular tooth. So when the crown becomes the leftover tooth structure, which is a natural tooth structure, becomes brittle, and if you're not covering it with a hardened material, like an artificial crown, what we use in dental industry, the pressure, the biting forces which are acting onto your natural tooth, if it is not covered by an artificial crown, the tooth tends to break off. So in order to protect the tooth, after the root canal treatment is done, we put a permanent filling, and then on top of that, we put the crown. Now, there are different kinds of crowns which are available. Initially, we started with metal ceramic, where there is a metal sheet which is there inside, and the ceramic is covering on top of it. So the metal gives the strength and the ceramic will match with the adjacent teeth depending upon what shade the particular patient has. Now there is a little drawback with this because the metals what we use in dentistry is typically a cobalt chromium or it's a different alloy, it's a combination of different materials. So most of the times it is either a cobalt chromium or nickel chromium. Now cobalt chromium is supposed to be very hard to trim. So initially we started with cobalt chromium, now we have moved to something called as nickel chromium. Now, there is about 2% of the population who are allergic to nickel. So obviously somebody who is allergic to nickel or somebody who's got any metal allergies or any allergy body issues, we definitely ask them to avoid going with a metal ceramic crown. The other disadvantage of a metal ceramic crown is there is a metal and ceramic is bonded on top of it. So during the hard biting forces, the ceramic could chip off and there is a little black patch which is visible. That is nothing but the metal which is inside. So in order to avoid all this, there are newer materials which have come into the dental market or the dental industry, which are really amazing. They give beautiful results, especially we are talking about an Emax crown, which is a lithium disilicate. It is nothing but like a glass particle. So it passes the light through and through like your natural tooth. And we normally use the Emax or the lithium disilicate crowns for the front anterior 6 or 8 teeth, depending upon the extension of the smile. Now, these can be mimicked exactly like a natural tooth. If suppose you have a missing tooth or a tooth which is root canal treated, the front one tooth, with an Emax crown, we can get exactly matched with the adjacent tooth because of the nature of the material, which is very translucent. Now, coming back to the back teeth, where right from your premolar, it's not just the aesthetics part of it. We need the physical function, which is very important. So for the back tooth, typically we use something called as Zirconia crowns, which is a little opaque. The reason for that is it's much more dense. So the strength is the major requirement here. So for the back teeth, we use something called as Zirconia crowns, and the front anterior, the cosmetic or the aesthetic cases, I would normally prefer using an Emax because it gives an excellent, beautiful results. So I'll just brush up again. After the root canal treatment, yes, I would say it is mandatory and it is very important to protect your own natural tooth with an artificial crown after the root canal is done. And as far as the materials are concerned, yes, there are different materials like your metal ceramic crown. Then you have your lithium disilicate Emax crown, which is typically used for the front teeth. And then you have the Zirconia crowns, which are used for the back teeth. So guys, somebody is out there getting a root canal treatment or has already got a root canal treatment, please don't neglect. Go back and get your crowns fixed onto the root canal treated tooth. Thank you. Thanks for watching.